Hello, I'm Dr. Doug Lair and welcome to the video. Today I want to share with you some very exciting things that I've learned over the past 33 years of practice. I'm a doctor of chiropractic, quantum medicine, and energy medicine. I've been a pioneer in this area for just about that long. And I want to share with you some really cool stuff to help you as a practitioner learn how to help your patients a lot more, at least get a really good idea of why patients don't respond to our care when they don't respond, and land that into some causes. So this is a 3-video series. This is video 1, and today we're going to talk about the first primary reason why clients, patients, students, I like to call them, because we're teachers and we're here to help our clients, our students, to really learn what's creating their problem so that they don't recreate it. Would that be a good idea? Have you ever worked on a patient, did a perfect acupuncture treatment? Awesome, the person responded. Then you did a chiropractic adjustment, boom, 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 and perfect. You did some nutrition, you're a naturopath, whatever you did, some physical therapy, exercises, modalities, etc., and then the patient went backward, or right back to the beginning, or they plateaued and we couldn't get them any further along the way. Why does that happen? So you probably have a few ideas. I want to share with you what I've discovered, and of course I've learned how to overcome all these obstacles that I'm going to share with you. But first, let's just get on with what they are so that we can begin to attune to this and make a greater difference for those who seek our help. Because that's why I went into this. First, I went into it because I want to help other people. Then I got sick and in extreme pain and suffering for a number of years because of 2 herniated discs and migraine headaches and irritable bowel syndrome, allergies, depression, and a few other things I've long forgotten. And it was these 3 sources I had to address. And by doing that, I was able to rehabilitate myself and get better than ever and have it long lasting year after year after year of my life. So here we go. We're going to start with the first reason why clients don't get well, or why they plateau, or why they go back to where we began, or why a new illness. That's right, even a new illness. We help them with one, and all of a sudden something else shows up. And we go, well, I always ask, well, why did that happen? All right, what did I miss? What wasn't covered? What did the patient do to create this? And that's very important, because clients have a way of creating their problems. We all do. We're all them clients. We're all people. And so they are 3 stressors, and I want to talk about the first one because we all realize the power and the potency of stress. And I want to talk to you about how it affects us physiologically, neurologically, hormonally, and how we can begin to address these things in an effective way and a safe way, of course. We're doing holistic work. Why do we do that? Because we wanted to work in a more whole way with our clients and not have side effects affect them. And I realize some of you listening are integrative medical doctors who want to do a more non-toxic or non-drug, more natural care, and the key is looking into why the patient has what they have. So, number 1 is trauma. Trauma. So let's talk about this. This is car accidents, falls, head injuries, sports injuries, work injuries, any kind of injury or physical trauma to the body. So some people get better 100%. That's great. Why? And a lot of people don't. Most don't. And a lot of times the conditions that we're treating them for seem unrelated from the trauma. So the first example that comes to mind is I had a man who came to see me many years ago, it's probably 25 years ago at least, and he had a motorcycle accident and he came to get rehabilitated for the motorcycle injuries. I was a specialist in work and car and motorcycle injuries. And at the time. So here he comes in, and trauma to the body, to the shoulders, to the spine, to the head, and I'm working with him to help his body heal. Now, this is vitally important. We got to get to these healing systems because I find that's always the key. Now, trauma interrupts and can dislodge this healing system and get the body stuck in a non-healing state. That's why people don't respond to our care if they're in an accident, an injury, a trauma, because it short circuits the system from rebooting into a healing system. There's two systems. I'll talk about that in just a moment. So what happened was, right after his accident, he also manifested diabetes. And now he's on insulin or glucagon. I don't remember which of the two, maybe both. I know he was on some drugs. So I helped him to de-traumatize his system, to get out of the trauma memory. And so here's what happens. You get a trauma, boom, whiplash, fall, head injury, hit the pavement, and the body remembers the injury, remembers the accident, and it records everything going on at that moment. It records what's on their mind, it records their emotional state, it records the physical impact and injury, and the body now has that in memory. And it can, and often does, most commonly, repeat that physiology over and over and over again. And as practitioners, we're trying to undo or unwind and help that person get better. So, once it's in memory, now the body is stuck in that situation. And we do our best. And the reason why they either don't get well or they plateau or don't get 100% is because this trauma memory and the things associated to it, because the brain's a wild thing. It'll take the sight, the sound, the emotion, the smell of the pavement, everything as inputs, and those things keep the body responding to that accident, injury, trauma over and over and over again. That's right. Even things that you're not even aware of unconsciously. So the brain and nervous system might be unconsciously thinking about work. And now work is now a stimulus for that person not to get better. So it's important to be able to delineate and figure out all the things that the body is responding to that's interfering with its ability to, that's right, heal. Now, there's two systems I mentioned earlier. One is survival and one is healing. So we have a healing system and a survival system. Survival, we know medically, is the sympathetic nervous system, and the healing system, rest, repair, digestion, relaxation, and sleep, is the parasympathetic nervous system. And when these things become way out of balance, either way, usually it's both can get exhausted, but this sympathetic nervous system will, when it keeps on being activated 24 hours a day through the subconscious memory, Guyton's medical physiology book does state that the brain and nervous system, which controls the body and all the functions, manages and regulates the systems, is controlled by the subconscious memory. And then that subconscious memory tells the brain to tell the systems what to do based on what's in the memory. And what's in there? A survival mechanism. Fight that bear, fight that tiger, fight that pavement, fight that car, fight that motorcycle, fight that wall we're about to hit. Then the person is going through rehab and working on that area and working on that area. I've literally seen people come in with injuries that have healed in literally 24 hours. 24 hours. I want to go back to the motorcycle man in just a moment, but it just reminds me of a man who came into me with a volsed bicep tendon, and his bicep was way up here. And he had just been to his medical doctor, and they were going to reattach it the next day. But he was already a patient of mine. He had torn it out doing some sort of activity. He was a contractor and pulled something up, and it was heavier than his arm could manage, and it ripped it out. And so I figured out what the stress was that actually hyper tensed that muscle in the first place. That's right. Since it was already super tight because of a stress making him want to punch that person that he was pissed at. Yeah, that's what was going on. Uh, he, we needed to get his nervous system to release that reaction and that response and that consciousness of being pissed off at that customer. And lo and behold, he came back the next day, said it reattached. He went to his medical doctor and said, "You ever seen that before?" And the doctor went, well, not really, but obviously it did. And he didn't need surgery. Wow. And I thought that was pretty cool. So let's go back to the man with diabetes and motorcycle accident. Motorcycle accident, trauma, he's stuck in that, and that induced a change in his hormonal system because the nervous system wanted to fight that tiger so intensely. Well, when the adrenal glands get told to fight a tiger, cortisol and adrenaline fire off over and over and over again intensely. Well, we know high cortisol is going to stimulate high insulin. And in that time, his system somehow shorted out because of the emotional sequencing and the already there weaknesses of his system. And so the manifestation was diabetes. And by working on him and getting him out of that trauma and the related stressors that had recorded in his nervous system, that trauma memory dissipated and then finally absolved itself. His body went into healing. His pain in his back and neck and shoulders, head, that went away. And that's right, his nervous system started re-regulating his hormones, adrenals, pancreas, liver, kidneys, etc., and the diabetes. That's right, the diabetes healed. And he was able to get off the drugs and live a normal, healthy life. Wow. Without the repercussions of injury, trauma, and the induced traumatic state of diabetes. So, what else can I share about this? So what I want you to do is when you take your history, really look carefully at that person and see what the traumas are. Because cumulative trauma, a head injury here, an accident there, it can build up until they now have the disease state that they have. Now, it may not be pain. Like this man, he had pain, he had decreased range of motion, he had dysfunction physiologically in his torso and his body, muscles, but he also had actually organic illness going on. He actually had the diabetes. That was a real diagnosis. So the MDs did good by him in helping him to manage that illness. But what we wanted to do was get his body to heal. And when you help a body to go from survival mode into healing mode, it's pretty exciting to just see the whole physiology change. And now this patient's all of a sudden going, whoa, my pain is gone, or my shoulder works, or I can breathe deeper. Oh, boom, next day they come back. Oh, I slept like I haven't slept in years. These are type of comments that you see when you activate the healing systems and get people out of that deep survival system. Pretty cool. So, thank you for joining me in this video about why your clients, patients, students don't get well. And the first thing to look for is these traumas, and to begin to get that person unstuck for that trauma and aware of the stressors related to that trauma. Sometimes easier said than done. I just happen to be doing this a long time, and I've learned how to literally talk to the cells and figure out what's going on with the person and how to get them unstuck. First thing is to understand that different stresses. Just a patient being aware of a stress, it's amazing the power of that alone. Just that alone. So get them in touch with that. Get them to rethink about that. Get them to let go, to forgive, to see the lesson, see the good in what happened. When that shifts the consciousness and it drops in at the physiological level, that's when we see these unexplained miracles. And for me, I like everyday miracles. I like to see those every day, and I do. So apply this and let me know how it goes. I'd love to hear from you. And we got, I think we may have some comment boxes depending on how we set this up. So if we do have comments, then hey, let me know. what's going on and how this is helping you to improve your ability and your confidence and excitement about practice even more to go, that's why that person isn't getting better, and how to begin to look at it a little bit differently. So I will see you on the next video. I'm excited to share with you the next type of stress that throws off a system and keeps a person from getting well, and a few tips on how you can begin to apply that and help your people do much better. All right, I'll see you then.